Hi, my name is Shauna Williams. I work at Widener Center for Social Work Education. My primary role is serving as the director of Social Work Counseling Services, which is social work's very own human services clinic. I also teach in the BSW program and the master's program. And today I'm going to be talking about how I've integrated a career as it relates to sexuality studies and social work. I do that as a perinatal support professional. There's lots of ways you can support people during the perinatal period. I do that as a doula and a lactation professional. So I am an alum of Widener's dual degree program. I got my BSW, my MSW, and my MED at Widener. And I have a business called SW Doula LLC, in which I work as an integrative doula and counselor as it relates to the folks that I serve as a perinatal professional. And I do that as a certified lactation counselor. I'm a certified doula. And I also am in my therapy practice, I serve a variety of folks, but I have a specialty in perinatal mental health. I'm in the PhD program, and my area of research is around maternal and infant health outcomes, African Americans, and how experiences of trauma have impacted those maternal and infant health outcomes. And so I became a student in the dual degree program because I was working as a educator in the areas of diversity education and sexuality education. And during my workshops, people were often talking about experiences of trauma and experiences of trauma that were infecting them today, even if they had experienced it a long time ago. And I decided I wanted to be able to provide more holistic care for those folks. And so after getting my BSW, I worked as a child welfare case manager and a direct support professional with folks who have intellectual and developmental disabilities. And then I got my master's degrees and I started working as a family therapist. I worked as a outpatient individual therapist, and I also started working as a counselor, specifically serving folks around areas of spirituality. But in all of the work that I did, none of them specifically wanted a sexuality professional. There was no sexuality professional with social work knowledge jobs available at that time. And so I really had to carve out how I could serve folks from a sexuality perspective in all of those fields. I really had to advocate that this was an area of specialty I had that I wanted to work with. And so that's just a piece of advice to carry with you, that you need a job and you may need to take one that doesn't necessarily align with those two areas of work, but you can make your niche in any of those areas. I also started out kind of more focused on sexuality education with desire to have more knowledge around social justice and some general counseling skills. And I left more focused on my social work career. And I just had a strong foundation of sexuality knowledge. And so I was surprised at that change in the way that I identified myself, but that could happen for you as well. So just be aware that your focus and where you have more strong interests might change throughout your education and throughout your career, and that's totally okay. But one of the things that started to happen to me was that a lot of folks had ideas about how I should be doing things. Maybe I should be a sexuality therapist. Maybe I should be a sex educator in certain arenas like religion or things like that. Nothing really felt right for me, and I was struggling to kind of figure out what made the most sense. So please excuse any background noise. My infant son is right next to me. And as I mentioned that I became a perinatal support professional as a result of my own parenting journey. So perinatal is a big word that basically refers to the period of time in which someone becomes pregnant, gives birth, and then is in the postpartum period and kind of those first early years of their young child's life. And so I had challenges in that entire arena as I became a parent. I had some really challenges around healthy pregnancies, having healthy babies, feeding my baby, having postpartum challenges as it relates to mental health. And so I started just in support networks that were informal in the community. So support groups that were in person or online. I started really being active in those groups. And then I got the opportunity to join a community coalition around breastfeeding in my local area. I ended up becoming the chairperson and still am the chairperson for that organization. And naturally, it started to become something of a focus in my research area as a student. And all my research, I kept coming across this aspect of doula work and how doulas were noted by the American College of Obstetrics and Gynecology to be one of the most effective interventions for helping folks have healthy pregnancies and healthy birth experiences. And so I went to a doula training, and by the time I left, I went really for research purposes, and I left saying, I need to be a doula. I just need to be a doula. I don't know how I'm going to do it, but I'm going to do it. Once I became a doula, that really opened up the other areas of perinatal profession for me. So I'm going to start by talking about my work as a doula. So doulas, I have a little graphic here on the left that just explains what a doula is, because folks often don't know. So a doula is trained in the midwifery model of care, but we are not medical professionals. We provide emotional, physical, and educational support to a birthing person and their family through the throughout pregnancy and throughout the first year of birth and beyond. And we also provide continuous support during labor and birth. Some doulas don't focus on that area. Some focus more on the postpartum area. But I've been trained in pregnancy, birth, and postpartum support. So I do all three. And that can look a lot of ways. Sometimes it looks like helping folks with positioning and massaging and help coaching them with breathing, similar to how this person is doing in the right. She's providing some pressure in an area that can help with relieving pain during a contraction. But also it can involve helping the patient advocate for themselves in the birth room as it relates to their desired birth plan. So, in the intersection of sexuality studies and social work, being a doula impacts a lot of areas. So, it's different. Being a doula is very different from social work with the amount of touch that's involved, but self determination is the core value of social work, and we're really helping folks develop a birth and postpartum plan that works best for them. So, it's really based in that. There's a lot of discussion about consent and how you can have, you need informed consent as a birthing person and how to advocate for informed consent. There's a lot of psychoeducation around sexuality and pregnancy and birth, which is part of sexual development. Really have to approach your client as a doula, and you're trained in this way, and it really aligns with social work with unconditional positive regard in a collaborative way that incorporates the whole family system. You really need to be have humility around culture and spirituality, because birth is a very cultural experience, it's a very spiritual experience. And also, reproductive health is an area that really needs advocacy, because certain vulnerable populations often have really, really major health disparities, particularly with queer folks. And we know Black folks have a lot of health disparities in this area. Immigrants, folks who are considered vulnerable in other ways in their life, often struggle with getting the support they need during the perinatal period. So briefly, I just want to talk about my lactation work. I am a certified lactation counselor. That's not the highest level of the lactation profession that you can work in. The highest level is a internationally board certified lactation consultant, or IBCLC. And so the way that I work at the CLC level is I really go in and offer support to families when they are first trying to provide human milk to their baby, by helping them with positioning, thinking through how they want to adjust to going back to work or adjust to those early weeks, helping them understand their body and their baby's body and how the two of them work together in this way. And so this is an area that is really important to be thinking about as a social worker, that we should be looking at, because infant mortality is a major issue for vulnerable populations like Black folks. And so we know that breastfeeding is one of the most effective interventions to reduce maternal mortality. Also, this is a food justice issue, food sustainability issue. It is a sexuality education issue and an economic justice issue because this is an area that people make a lot of money off of folks by kind of selling formula. And some people definitely need formula, but what we find is that often folks who have a low supply is because they did not get the type of support they needed. They weren't provided it. And so we need to be someone who could do that for people. And particularly for folks who don't fit the binary gender identity. So a person who is trans may want to breastfeed, but they may not identify as having breasts. They prefer using a more gender inclusive word like chest feeding, and they may approach it differently. And so we can approach using our both areas of knowledge in supporting folks in that arena. And so perinatal mental health is really becoming a specialization of mental health treatment. There's additional certifications and training specifically around perinatal mental health. And so perinatal mental health, if it's the area of clinical work that you're interested in, really is a wonderful way to also support folks in the perinatal period solely from the approach of counseling. And so the integration of sexuality and social work is really needed in the birth field, and we would really bring something very special to it. First of all, as I noted, there's a lot of social and political areas of action that social workers need to be concerned about as it relates to people during the perinatal period. We're hearing a lot about Black maternal mortality and infant mortality. We're even hearing about it in the presidential election. So, in the race and the debates about this topic, about becoming president, people are talking about this issue. And so, it's important that we're thinking about it as well. Also, psychoeducation is something that we're really good at, and this is an area in which a lot of psychoeducation is provided to clients. Perinatal mood disorder often involves couples issues and issues of sexuality. Who are we as a couple? Who am I as a person now that I'm a parent? And so we could bring a lot of support to that area. Also, pregnancy is part of sexual development, and sexuality is part of pregnancy. Organizations like Orgasmic Birth are doing a lot of talking about this, but there needs to be more people in the field who feel comfortable with both areas of not just providing human service support, but being able to talk about sexuality. And there's lots of ways that you can engage in the perinatal support field. You could work as an abortion doula, helping support folks who are terminating a pregnancy. You could work with as a fertility doula. You could be a childbirth educator. There's a lot of areas of advocacy that can happen on the micro and macro level. And so I really think that we are needed in this field. And I really love to talk to dual degree students about this because I can see the need for us. Additionally, the birth world is really just catching on that trauma is something that impacts experiences of birth, and sometimes it's caused by experiences of birth. And so social work is really a needed addition. A lot of birth workers are talking about it now, but it's really new to the field. And the world of maternal infant health itself is very, very gendered. So folks who are queer in many ways experience microaggressions that impact their health outcomes related to this arena. So again, we're really, really needed in this work. I could talk about this all day, but if you are interested in having a longer discussion about this or you find this topic really interesting, please feel free to reach out to me. The best way to reach me is through my email, smwilliams2@widener.edu. You could follow me on my business page on Facebook, and you have to put in my whole title because that's my Facebook name if you were interested in that. It's Shauna M. Williams, LCSW, MED. If you wanted to check out my website, it is www.mysocialworkdoula.com or myswdoula.com. And I look forward to talking with folks who are interested more about this. Good luck on the rest of your education journey. Thank you.